Are you experiencing persistent elbow pain that limits your daily activities? You might be suffering from tennis elbow or golfer's elbow, common overuse injuries. This video will provide a comprehensive, step-by-step guide to help you recover from these conditions at home without the need for surgery. First, let's understand the anatomy of elbow pain. The elbow joint involves the humerus, radius, and ulna bones, stabilized by muscles, ligaments, and tendons. Tennis elbow, or lateral epicondylitis, causes pain on the outer part of the elbow, often due to damage to the extensor carpi radialis brevis muscle. In contrast, golfer's elbow, or medial epicondylitis, affects the inside of the elbow, implicating muscles like the pronator teres and flexor carpi radialis. A crucial part of recovery involves eccentric exercises, which lengthen the muscle while contracting it, promoting tendon healing and remodeling. For eccentric wrist extension, rest your forearm on a table with your palm down, lift your wrist with your other hand, then slowly lower it. Similarly, for eccentric wrist flexion, perform the exercise with your palm facing up, slowly lowering your hand. Regular stretching is vital for maintaining flexibility and reducing strain on the muscles and tendons around the elbow joint. To stretch your wrist extensors, extend your arm with your palm down, then gently bend your wrist downward with your other hand. For the wrist flexor stretch, extend your arm with your palm up, then gently bend your wrist downward to feel the stretch in your inner forearm. Strengthening exercises help the muscles around the elbow absorb force, protecting the tendons from overuse. Grip strengthening can be done by squeezing a soft stress ball for 5 seconds, relaxing, and repeating 10 to 15 times. Wrist curls, using a light dumbbell, involve resting your forearm on a table and slowly lifting your hand towards the ceiling. Forearm pronation and supination involve rotating your forearm from palm down to palm up, with your elbow bent at 90 degrees. Proper gripping and technique are essential to prevent strain. Consider using ergonomic tools with padded handles to reduce vibration. When lifting, use your legs, not your back or arms, and avoid twisting your arms suddenly. Turn your entire body instead. For sports like tennis or golf, refine your technique with a coach to ensure proper kinetic chain movement, transferring power smoothly. Avoid gripping tools or sports equipment too tightly, as this increases tension in your forearm and elbow muscles. Lifestyle adjustments and prevention are key. Rest and modify activities that exacerbate your pain to reduce repetitive movements. Apply a cold compress for 15 to 20 minutes to reduce inflammation, especially in the first 48 hours after an injury. Use a warm compress to relax stiff muscles and improve blood flow, aiding in the healing process. Stay hydrated to lubricate joints and reduce friction, and eat a healthy diet rich in fruits, vegetables, and lean proteins. Maintain good posture to avoid straining joints, especially when working on a computer, and take frequent breaks from repetitive tasks. Healing from tennis elbow and golfer's elbow without surgery requires a comprehensive approach. It involves understanding your condition, diligently performing eccentric exercises, stretching, and strengthening. Adopting proper techniques in daily activities and sports, along with making appropriate lifestyle adjustments, are equally important. Remember to be patient with the healing process, as recovery can take time and consistent effort. If you experience severe pain, or if your symptoms persist despite these measures, please consult a doctor for professional medical advice.